Hello, and thanks for joining us again for Sandwell Children's Safeguarding Partnership podcasts. My name's Leanne, and I'm the Learning and Development Coordinator for Sandwell Children's Safeguarding Partnership. I'm joined today by Joanne for a quick chat about the neglect screening tool. Jo, can you introduce yourself?
Yeah, hi, I'm Joanne Toofey. I'm an Associate Named Nurse for Safeguarding Children at Sandwell and West Birmingham NHS Trust.
Thanks, Jo. So just a reminder of the definition of neglect from Working Together 2023. It is the persistent failure to meet a child's physical and/or emotional needs likely to result in serious impairment of the child's health or development. It may involve a parent or carer failing to provide adequate food, shelter and clothing, failing to protect a child from physical harm or danger, or the failure to ensure access to appropriate medical care or treatment or provide a suitable education. It may also include neglect of or unresponsiveness to a child's basic emotional needs. The screening tool was developed as part of the new approach to tackling neglect in Sandwell that was launched earlier this year as an aid for professionals working with children and families. Jo, can you tell us a bit about it, please?
Yeah, so the neglect screening tool offers a checklist for professionals who might be worried or unsure about the care a child is receiving from their parents or carers. They might be worried that a child isn't receiving good enough care at home or is experiencing a form of neglect. So the screening tool is broken down into 6 categories of neglect, which are physical, medical, lack of supervision, educational, emotional and nutritional neglect. So the screening tool offers statements in each category of neglect for the professional to consider. If they've noticed or they're worried that there could be neglect in that category, the professional would tick yes and then give a brief overview of the concerns that they have. At the end of the screening tool, there is a pathway for what staff need to do next, and this is based on how many yes ticks there are. So it's a quick assessment for staff and it supports them in making decisions on what their next steps should be. This supports staff in following the neglect pathway.
Brilliant. It sounds really useful and a kind of really quick way to gather your thoughts and worries together in one central place so you can make the best decision for that family as to what to do next. Have you used the screening tool?
Yeah, so as a safeguarding nurse, I offer advice and supervision to health practitioners. So I've recommended the neglect screening tool as part of the assessment of the child's needs. So we recommend that this tool is used with the family or the child, although it can be completed as a professional tool and used to inform reflective discussions about the family or in supervision.
Okay, so something to do with a family that can be part of a conversation you have with them, or as a reflective tool to gather your thoughts around what's going on for a family so you can support them in the right direction. Sounds great. Can you give us any examples of how the tool might be used in your service area across health?
Yeah, so an example might be if a child presents in the emergency department. That child may only be there for a short period of time due to ill health, and those looking after the child may have limited interaction with them, and they might also be looking after several other patients. So in the interaction with the child and their family, they might have some concerns about neglectful care that's taking place. So some examples might be for the child's presentation, if the child's dirty or clothes are ill-fitting or not weather appropriate. We might think about physical neglect. Late presentation with symptoms or repeat presentation with symptoms that indicate health needs aren't being managed well, so medical neglect or supervisory neglect could be indicated by some types of accidents. So we wouldn't expect staff in the emergency department to complete a graded care profile 2 assessment because they wouldn't have the time or the continued involvement with the family to start or complete a GCP2.
Of course.
But instead we would suggest that they complete the neglect screening tool. So staff working at the hospital, the MMUH, can use the Sandwell and West Birmingham NHS Trust paediatric liaison support process to share this information with community health care professionals such as health visitors or school health nurses. and that comes via our Safeguarding Children team. So these community professionals might already know the family, so that makes them better placed potentially to build a relationship with the family, follow up on the concerns and offer advice, guidance or support. The health visitor or the school nurse might then go on to gain consent to start or complete the GCP2, and that would be using a collaborative approach with other agencies working with the child and family. So, for example, education, a children's centre or the GP.
Brilliant. So it sounds like then in a kind of an emergency situation, in an emergency department, we expect our nurses to be doing lots of different things and taking care of lots of patients. So they wouldn't have time to do that fuller assessment, but they would have time to mark their thoughts down on a screening tool and pass those on to those staff that do have that prolonged contact. That sounds like a great idea and a brilliant system that you've got in place.
Yeah, and obviously in an emergency situation where there were significant safeguarding concerns, we'd always ask staff to follow the safeguarding policy and contact children's social care where appropriate. The neglect screening tool can lead to additional help from services and professionals that are already known to the family, and it can ensure that families have the support they need to improve outcomes for children by addressing those concerns that have been identified.
And that's what we're all working towards, isn't it? Those improved outcomes. It sounds like a really great way of making sure that those worries don't get lost, or somebody thinks something but doesn't mark it down because they're super busy. So that's recognised, it's passed on to an appropriate person that's working with the family, so that right support is in place.
Yeah, it really is. I would advocate for anyone who has concerns about neglect but needs to pull their thoughts together to use that screening tool, especially for services where there is limited contact with families, such as the ED in a hospital. It's a great way of capturing information to evidence concerns in a structured way, and then that can be shared with other services and professionals working with families.
Sounds great, and like we can all benefit from taking a look at where we could be using the screening tool in our roles across the partnership in Sandwell. There is now a standalone form in EHM or the Early Help module, or in Old Money if you still want to call it ECAF. So if a family is open on the system, you can document it straight into there, as well as a downloadable version of the screening tool on the Sandwell Children's Safeguarding Partnership website. So if anybody's completing it outside of the system, you can download it, store it then within your own kind of filing systems. Thank you so much for your time today, Jo. Have you got any last words of wisdom for us?
Yeah, I would just recommend that if there are staff working for Sandwell and West Birmingham NHS Trust, to just contact the Safeguarding Children team if they've got any questions about the neglect screening tool, because we are here to offer advice and support.
Yeah, no, absolutely, I'm sure you are. That's it then for today. So a quick, short and sweet one just around the screening tool, and hopefully people have found it useful in terms of reflecting where they can use it in their own practice, using the examples around health and the emergency departments and how we can pass that information between ourselves rather than it getting lost in the system. I will pop a link in the description to the screening tool on our website, but again, don't forget it is inbuilt into the Early Help module system, so if you're working on that system you can find it in there to attach to the children and families that you're already working with. Thanks again, and see you next time.